I'm here again today with Bonny Specker, epidemiologist, who is going to give us an update on the COVID-19 situation over the last week. But before that, we are going to talk a little bit about some of the misinformation that has been circulating. And, it's really important with COVID-19, as information comes out and since it's a new virus, as we learn about that virus, to keep yourself informed. But what are some of the ways that an individual can get the information that they need, but make sure that the information that they're getting is valid and the truthful information that they really can depend upon?
Thanks, Chelsea. As Chelsea said, we want to talk about misinformation today. But before I get to that, I want to go over new CDC mask recommendations that came out yesterday. This is a really nice graphic that summarizes what the current recommendations are for people that are fully vaccinated, which is on the right here, and then people who are not vaccinated. And it's important to remember that these new recommendations are there until widespread vaccination is achieved. So once a high percent of the population has been vaccinated, this is going to change. There's going to be a lot more of these boxes that don't have the people with masks on. But until then, since there aren't a high percent vaccinated, we need it really up around 70%. They are asking that people who have been vaccinated continue to wear masks indoors in all indoor activities, and then also in crowded outdoor activities. Here on this side, the yellow are the least or less safe situations, and the red are the least safe. So if someone's not vaccinated, even if they have a mask, they aren't particularly safe in a lot of these situations. The website that this particular graphic's on and is discussed is given here at the bottom of the slide, and I'm sure Chelsea will be putting that as a link at the bottom of this video.
Yes, I will be putting that link out, and I also want to say that it is also available on the COVID-19 page of the City of Brookings website. If you go there to get information, it's there for you.
She's on the ball. As far as misinformation, you see a lot of things out there, and I'll talk about a couple of those things this afternoon. But where the two places that I find really good to go to check on things that I might see on social media are PolitiFact and then also AP News. These links, this is their coronavirus. They have a lot of other topics that they do fact checks on. And then the AP fact check site. This one, I thought, this just cracks me up. Not real news, a look at what didn't happen this week. And so these are pretty much things that are coming off of social media, and they share that with people, and they provide you with information on why it's not valid or what they found when they investigated it. This particular one is something off of PolitiFact. They have these little I don't know what you would call them, meters. And you can see that most of these are false. They also have actually true, and you'll see ones that will say true or mostly true, or here we have mostly false. So there's some truth to it, but if you click on these when you go to their website, it takes you to a page that goes over each one of these statements. What is it that's wrong about this particular statement? What's the evidence that shows that it's either correct or wrong? Here we have pants on fire. This is one where it's really wrong. And I think this is a great website for people to see what they're running across with social media. And this one here, this Stanford study showing that face masks are ineffective and dangerous, is actually the same one as over here, saying that there's science out there that shows that masks might cause these particular conditions. And one of the things that was interesting is that that particular paper was written in a scientific journal called Medical Hypotheses, which the purpose of that journal is to publish sort of wild speculations or wild ideas. Because there are sometimes wild ideas might lead to something. But there were quite a few things wrong about that particular paper. One of them was that it was citing a lot of incorrect evidence or interpreting scientific evidence incorrectly. And you can actually read the PolitiFact article and it will tell you what it was that was wrong. But another thing that came out is that that person stated that they were actually from Stanford, that they worked at the VA Palo Alto Health System and were affiliated with Stanford. Well, Stanford did send out a tweet, I should say, saying that it's not a Stanford study, and that the author's affiliation was incorrectly attributed to Stanford. He had been at Stanford back in 2016 for a one-year appointment as a visiting scholar. This was an exercise scientist who was only there for 1 year doing something completely unrelated to COVID. So I think it's important to realize, this one came out, I shouldn't say Stanford, it's Stanford study shows face masks are ineffective and dangerous. That was a very incorrect statement. One that I noticed was trending today, and this was coming off of AP News, is that herpes or shingles may be a side effect of the COVID-19 vaccine. And this particular link, if I were to have clicked on this on the AP website, it would have taken me to an actual discussion of this study and why that statement is not correct. So I just think it's important for people to pay attention to what they see out there and to check it. There are, the CDC website is extremely valuable when it comes to facts. And also the Department of Health, the South Dakota Department of Health also has a lot of information. So
I agree. I think it's so important that, individuals inform themselves and make sure that they have the most up-to-date information. And I just always go back to those services, our state health department, they put information out as it comes out, and so does the CDC. So when in doubt, always go back to those as your staples for getting the most up-to-date information related to COVID-19. But if you do see something that you question, or you want to find out if it's true or not, there are some ways that you can fact check that. And the Poynter Institute that does PolitiFact and the Associated Press are two well-known organizations that are known for putting out factual information and having high ethics in journalism. So these are really great places to look for that misinformation.
And I think the other thing too, Chelsea, that is important is it's not just with COVID. They do it on all topics. And I think that's also helpful for other areas that people might see things.
So thank you, Bonnie. So what else do you have about COVID? What's been happening over the last week?
Well, in some places, it's better than other places. So this is as of today's data for the state and the county, what was posted. It's through what was posted today on the Department of Health's dashboard. This is Brookings. We are definitely going down. We still have substantial spread this past week. we can get this little blue bar below the orange line for 2 weeks, then we get taken off the Department of Health list of substantial spread counties and get put into that moderate spread. So that would be good to be, place to be is down in here. So the total cases, 4,171 cases. You can see this drop from here to here. We have 45 cases in this past week and 78 in the previous week. Hospitalizations for Brookings County, we only had 1 this week compared to 2 last week. And we haven't had any deaths for quite a while, which is also good. And these are likely due to the vaccinations in the older populations. If you look at the state is right, it's very close to being in moderate spread at the state level. It needs to get down to 864 cases a week. This past week it was at 881. The week before it was at about 1,100. So, you know, we need to be getting down, that's more down than we are. This is the hospitalization data. This blue line is the current number that's currently hospitalized. So you want to, that number's over here. And then this purplish bar and the yellow are the axes for that are over here, and they're almost identical, the axes. At some points during the past year, they've been different. But as far as currently hospitalized, as of today, there are 103 people hospitalized in the state. 31 of them are in the ICU. Last week, there were 115 hospitalized last Wednesday and 26 in the ICU. One thing that's kind of interesting that I noticed is you can see here, we're going down just a little bit, but this ICU is going up. I don't know if that's like a continuing trend, but this is having about 30% of the patients that are hospitalized in the ICU. This is the highest percent of hospitalized patients in the ICU that we've ever had. So I don't know if the patients are just getting sicker or if maybe they're able to handle some of the cases that are not as sick as an outpatient. So it's something that I'll be watching, because it just is something that I noticed that I'm not sure how to interpret it at the time. Total hospital admissions around 7,300. Again, we had less this week. You can see that here in the purple bars. It's dropping. We had 76 people hospitalized this past week compared to 93 in the week before. And up here we say hospitalizations after 4/21 are incomplete. That's just because there are some of the smaller hospitals that take longer. They can take up to a week to actually put the data onto the Department of Health website. So what these bars are, you know, there may be new admissions since 4/21, but they haven't been tabulated by the Department of Health as of today. So there's a little bit of lag there. And you see the same thing with deaths. Here's what you see with deaths. The last death is April 19th. But, you know, we have deaths recorded here, but these deaths occurred prior to April 19th. The date I put here is the date that it actually appeared on the Department of Health dashboard. So we're getting close to that 2,000 deaths. There were 8 of them this past week compared to 6 the week before. So not much difference there. This is the percent of the population receiving at least 1 vaccine by age group for both the state and then for Brookings County. And Brookings County's in the blue. The state is in yellow. You can see that at all age groups, Brookings County has a higher vaccination rate. until you get down into the 20 to 29 year age group, where there's a slight difference. And these came out pretty good this past week for Brookings County. So if we look at what percent of the population is actually tested positive, so this is since the beginning of this pandemic, you can see that Brookings County in all age groups, we have a lower percent of our population having tested positive compared to the state. The state's in the yellow. The highest group for positive tests is this 20 to 29 year age group, and the second highest is this 40 to 49 year age group. If you look at the United States, what you see is we have about close to 33 million cases, 390,000 this past week compared to 466,000 roughly the week before. You can see that drop here. So we are going down. We're at probably the lowest since back in October. So that's a good sign. And this one I don't usually give, but I just wanted to remind people that, and part of this is because when looking at the misinformation, one of the things that I saw was that, you know, there's been more deaths from the flu than there have been from COVID. And I just want to remind people that if you look at the total deaths in the United States, we're at 587,000. You know, that is more deaths than both world wars combined, and far more than what you see during an average flu year. And that's way down here. Many months ago, I was tracking that, and then it became kind of insignificant relative to what the deaths have been in world wars. Here are the deaths in the US, the 587,000. Like I mentioned, we had about 5,000 this past week compared to 5,300 the week before. So it is dropping a little bit, which is good. We're out of this big peak, it looks like. Now here, this is the world, and the world is where things are not looking very good. We have 149 million cases, 5.7, 5.8 million cases this past week compared to 5.5 the week before. Almost 35 to 40% of these cases are ones in India. And I don't know if people have seen some of the news on that, but it's a really bad situation. I think there's a lot of countries that are now doing things to help there. If you look at deaths, 3.1 million deaths, 91,000 this past week compared to close to 86,000 the week before. So we're definitely in a second peak globally for this virus. So protect yourself and especially each other. It's important that we watch out for each other here. Wear a mask, wash your hands, socially distance, avoid crowds and poorly ventilated spaces. Thank goodness it's spring and we can get out more, and also get vaccinated if you're not yet vaccinated.
Well, thank you, Bonnie. I appreciate the update, and we will see you again next week.
Thank you, Chelsea.